Bonjour, everyone. I'm Linda Silas. I'm national president for the Canadian Federation of Nurses Union, and I'm calling tonight from New Brunswick, the beautiful land of the Mi'kmaq people. So first of all, a big merci for bringing up this important topic, this important social discussion, or as Anthony said, a good public policy. As you heard Dr. Morgan talk, he's been researching this for 30 years. Well, I think I've been lobbying for this for probably 20 plus years. A national Pharmacare program is not only key for sick Canadians and their family, but for every healthcare administrator that is out there trying to find money to fund primary health care, long-term care, home care, and acute care. All our healthcare system are in dire need for funding, and we look at the waste we are doing without a national Pharmacare program. Nurses, like many other healthcare workers who gets their hand dirty in our healthcare system, have recognized for 20 plus years that we needed a national system for our prescription drugs. What we're doing is dangerous and wasting money. And how can we continue justifying cutbacks in healthcare when we know that we're in some situation just wasting funding for prescription drugs or not funding them properly? We know that a lot of patients are either in hospitals because they can't afford the prescription drug, not taking them properly, or the price of prescription drug is going up and up and up, not only for us as citizens, but for our healthcare system as all. As Dr. Morgan said, we need a system that will not only bulk buy like the Costco model, but look at the best practices across the world and how can we better do it in Canada. You heard Dr. Morgan talk about savings. You know, is it 4 billion? Is it 7 billion? Some even say it goes up to 11 billion. There's many economists looking at a national Pharmacare program. Regardless if it's 4 billion or 7 billion, it's a lot of zeros and a lot of taxpayer dollars that could be put into our healthcare system in a better way. And how do we support it? When we talk about access and barriers to prescription drugs, it is more than the big cancer treatments, and that's what comes to mind often. But we need to talk about preventive care. All those high blood pressure prescription drugs that will reduce risk of strokes, of heart attacks. Of course, that brings you to hospitalization, or the asthma puffers for children that will stop them from being hospitalized instead of going to schools. That's why we need a national Pharmacare program. It's for prevention of chronic disease, but also looking at the big cancer and the rare disease, as you will hear from another speaker in a minute. Also, we're talking about access and barriers. Some would define it as diagnosis or treatment. That's our whole primary health care. We need to improve our primary health care, and that's more doctors, more nurse practitioners into a system. But let's be real. If a nurse practitioner or a doctor prescribes you your needed medication and it's on a piece of paper, but it's only a piece of paper if you don't have access to get the prescription drug that's needed, that means you don't have the means to pay for it. I remember the good old days when I worked in the emergency departments where we were able to give sandwiches to those who were hungry and samples to those who needed it. It is very hard to do that today, and only some physicians are lucky enough to do it on certain cases, but this is not how we should be funding our healthcare system through samples. We need to do better. We talk a lot about half-truths in Canada. Most, for example, our healthcare system is very modern, or most workers are covered for prescription drugs. No, 60% of workers are covered with some kind of prescription drug. It's a mishmash. You heard Dr. Morgan talked about, some say close to 100,000 different private plans with different rules. And if you change employment, your rules are changing, and often they're just decreased. Public plan is the same thing. I'm in New Brunswick right now, different plan than PI or Ontario or BC. And you have to think twice before you move if you're 65 or if you have a chronic disease. It's all about a high cost and equality of coverage. And on top of that, during the pandemic, we looked at the workforce. Twice the numbers of workers lost their coverage compared to those who got coverage through a private insurance. So we have to look at it there. Now, our healthcare system is modern. That's another half truth. There's not even links between most prescribers, physician or nurse practitioner, the pharmacy, and the patients. And never mind the best practices, because that's the way of saving money in the system on the best practices for the drugs. So we need to put all of that into one circle and make it better. What I'm reminded every day is we're a large country, but we're small in population, 37 million. California has more population than we have in our whole country. So with 37 million people, we have to learn to work together and have social programs that will help all of us. Merci, thank you.